Doctor. I have so many questions.
This is me, the doc. This is me, the doc.
Doctor,
This is me. This is me. This is me, the doc. This is me, the doc. This is me, the doc. This is me. This is me. This is me, the doc. I'm the doc because I'm fly. You ain't because you not. This is me. This is me. This is me, the doc. I'm the doc because I'm fly. You ain't because you not. This is me. This is me. This is me, the doc. It's about me, the doc. I don't gotta listen. I can make a meal going deep sea fishing. I represent healthcare. I got it on my plaque. Patients say that we lost it, so I'ma bring it back. I love me and myself, cause nothing else matters. You don't have to fear, cause I got magic powers. But to make the most cash, I gotta be in and out, so that I can make millions by the time that I clock out. If you needed answers, go take it somewhere else. I ain't answering questions. Do I look like Dr. House? I'm headed out of town, going west to LA. Next week when you come and you're gonna see my PA riding in first class, that's all that I fly. Just take these meds, don't try and ask why. Don't have time for your problems, why you gotta cry. You ask me why I'm like this, I simply reply. This is me, the doc. This is me, the doc. This is me, this is me, this is me, the doc. This is me, the doc.
Doctor.
Hello, sunny South Florida. We're coming to you live from NSU News. I'm Chanel Stanford.
And I'm Jen Neely. Today we are discussing astonishing news regarding inner city populations and migrant city workers in relation to healthcare.
One of the greatest issues in today's healthcare system is access to medical care in underserved populations. Over 34 million inner city residents haven't had access to healthcare, and the number has been growing since the late 1980s.
The Miami-Dade County has the highest rates of uninsurance in Florida out of any geographic county, and thus the lowest access to care.
The provider-to-patient ratio in these areas is approximately 0.9 active physicians per 1,000 inner city residents. This being said, only 33% of those active physicians are in primary care.
Experts have stated that there are not going to be enough primary care physicians, family doctors, internists, and pediatricians to care for all the newly insured patients this year. Hospitals and clinics are constantly staffing allied health professionals to fill this void. Having more generalists in these underserved areas will increase preventative and routine care. Physician assistants are needed to resolve this issue.
Definitely, and beyond simply filling in the gaps that exist today in providing primary medical care, these health professionals are also needed to keep patients healthy and out of the more expensive hospital setting.
Physician assistants are primary health care providers that perform general primary care, and with proper recruitment and retention strategies in these underserved areas have the ability to improve the access of primary medical care to medically underserved populations.
Well, nearly 75% of healthcare facility managers in staff care survey said that they had been temporary doctors and or advanced practitioners like nurse practitioners or PAs in the last 12 months.
Wow. According to a new survey from Temporary Healthcare Staffing from Staff Care, the number of PA and nurse practitioner temporary staffing requests increased from accounting for just 2% of all requests in 2010 to accounting for 10% in 2012. That's a huge increase.
Well, to top that, according to the National Health Service Corps, nationally, 15% of all PAs practice in rural and inner city areas, and they often serve as the primary providers in these types of communities.
Well, according to the BLS, the demand for PAs between 2018 will increase by 39%.
39%, guys.
That's huge. And now here's to Kirsty for our short sports segment.
Those were some astonishing facts, ladies.
Why, thank you.
Goodbye, LeBron James. Hello, God need pollen. This guy, he might not look too intimidating, but he is one of the best players in the game. Top of his middle school and high school classes. This guy, he can do a layup, he can dribble, he knows what he's doing. So there's no need to worry, Miami Heat players. Fans.
Diane, I'm your PA today. I'll be examining you.
Oh, hi. What's a PA?
Well, a PA is a physician assistant who can examine, diagnose, and treat a patient under the supervision of a doctor.
I'm so confused. I couldn't do anything that doctor said to do. Can you help me figure out what I'm supposed to do?
Absolutely. I'm great that you came to see me about this. This is very important. So we'll go through everything slowly and make sure you understand everything, okay?
Oh,
I'll be right back.
That would be great. Oh, wow. Boy, finally I might have a clinician who can tell me what I'm supposed to do. So confusing all the time.
Oh, what a beautiful morning. Oh, what a beautiful day. I'm being cared for by a PA. Everything's going my way. All my worries have left me today. All my worries have left me today. My PA listens and she cares about me. I know I'm in good hands, that's easy to see. Oh, what a beautiful morning. Oh, what a beautiful day. I'm being cared for by a PA. Everything's going my way.
Hello, my name is Louisa,
And I'm Kirsty Blue.
and we're going to be focusing on migrant workers. A migrant is a person who goes from one place to another, especially to find work.
Millions of Hispanics come to America looking for jobs and education, but remaining here seems to be bad for their health. The longer Hispanics are here, the more likely they are to become obese, to develop diabetes, high blood pressure, and heart disease. Miami and Fort Lauderdale, Florida are often described as the gateway to Latin America and is number 1 on the list of the most foreign-born residents in America. It has a large Cuban population, and nearly 60% of Miami is Spanish-speaking. The immigrant population in this area is approximately 2 million, and the percent of Hispanics born here is 36.95. The U.S. Census data shows that immigrants are more likely to be uninsured than native-born citizens. Overall, non-citizen immigrants are more than 3 times as likely to be uninsured as native-born citizens. The discrepancy between immigrants and native-born citizens persists among those with incomes below 200% of the poverty line. High blood pressure climbs from 13.4% for newly arrival immigrants to 19.8% for those that have been here longer. As immigrants stay longer than 5 years, diabetes raises from 6.9% to 7.5%, and heart disease increases from 3.5% to 5.4%, and obesity rates raise as well. This may be due to changes in lifestyle, including an unhealthy diet. However, the poll suggests that Latino immigrants generally do not perceive their diet as less healthy in the United States. About 4 in 10, or 38% of immigrants, said their diet is healthier in the United States. And the same number see their diet as about equally as healthy. 1 in 5 see their diet as less healthy. Cuban immigrants are significantly more likely to see their diet as more healthy in the United States than immigrants of the Dominican Republic, Mexico, and South America. Researchers have long cited diabetes as a threat for the nation's Latino population. According to the Center for Disease Control and Prevention, Hispanic adults are 1.7 times more likely than non-Hispanic white adults to have been diagnosed with diabetes by a physician, and 1.5 times more likely to die from diabetes. Among Latinos who have received medical care during the past 12 months, about 1 in 5 rate the health services they received as fair to poor.
Oh, so Kirsty, this means that physician assistants could be of greater value in providing satisfactory health services to this population. By spending time with patients instead of rushing, getting to know them, educating them, and genuinely caring for their overall well-being, for their health services satisfaction would increase.
That's very true, Louisa.
So many migrant workers in the Florida area work in farms. Studies suggest they are 6 times more likely to develop tuberculosis than the general population of employed adults. According to the CDC, the following are the services that should be available to migrant and seasonal farm workers and their family members. Detection of diagnosis and those with the current symptoms of tuberculosis. The second would be treatment and monitoring for those with the disease. The third would be contact investigation and appropriate preventive therapy for those exposed to infectious persons. Then would be screening and preventive therapy for the immunosuppressed, such as those with HIV. Then would be screening and preventative therapy for migrant workers with children. And then would be widespread tuberculin test screening for workers and families with preventive therapy prescribed. Ideally, patients should be placed on directly observed therapy given by a well-trained outreach worker from the same cultural language background as the patients.
So due to the shortage of primary care physicians, physician assistants can take over much of these needed responsibilities to ensure that diagnosing, treatment, and preventions of tuberculosis and other diseases.
Yes, and of an estimated 518 persons 16 years or older residing in 14 migrant camps in Florida, 8% had reactive serologic testing for syphilis, 5% were HIV-1 antibody seropositive, and 47% of participants had never used a condom.
Wow, that's amazing. While providing care for these patients, physician assistants can take the time to educate their patients and the families about safe practices that will reduce the spread of sexually transmitted diseases. In other breaking news, there has been a recent surge of immigrants at the Texas-Mexico border, many of who are unaccompanied minors. These immigrants are being kept in detention centers and facilities where there is a lack of sufficient medical screenings.
State health officials touring one of the detention centers in Texas recently reported several issues, including a lack of medicine for children and insufficient medical screenings and testing for vaccinations or tuberculosis. They also noted that the children in the facility ate, slept, and used the bathroom in the same crowded areas with no running water or soap for proper hygiene to prevent the spread of the disease.
These conditions are very concerning because we could very easily see major outbreaks in these centers in border towns of diseases like measles, influenza, and tuberculosis.
This problem is not just a problem among the border towns, as thousands of immigrants are released from detention centers to await their day in court. Reports have surfaced that they are boarding buses for destinations as far as New York, so they could even affect Florida too.
Wow, that's just amazing.
Yeah. So, we just learned a lot of really useful information regarding migrant workers and inner city populations and their health care.
Yes, we did. Oh, breaking news. NSU physician assistants are receiving their white coats. Let's tune in live to watch Armando Garcia receive his white coat. Wow, Michelle Obama even came.
Wow, that's fantastic, supporting the physician assistants.
What a turnout. Congratulations to all the NSU physician assistants for receiving their white coats.